The other issue is about the word efficacy. We always hear those two words together. Vaccines are safe and effective. What is the real definition of efficacy? I think when parents hear the word efficacy or other doctors hear the word efficacy, they think of effective, it works, it keeps me from getting sick. But that's not really the definition of efficacy inside of vaccination research. What efficacy means is that it did a job. I injected you with something and you developed an antibody. Does that antibody keep you from getting sick? We don't know. That's the theory. We think it might, but we know of many cases that people had antibodies that they got sick anyways. And if vaccines were so good for us, why do we have to pass laws that mandate and require you to take them? Wouldn't everybody just say, oh, it's just like a vitamin. I should run right out and get my vaccine if it was so good for me. Most of the discussion when you start talking about vaccines, the place where the discussion always starts is, what about smallpox? Well, as it turns out, with smallpox, less than 10% of the entire population was vaccinated with the smallpox vaccine. And what really made smallpox go away had to do with hygiene and stopping sleeping on straw mats and having better places for people to live. Even the CDC, Dr. Tom Mack, who is one of the lead researchers for smallpox eradication programs around the world, he said in his own words, smallpox was well on its way out in the 80s. It would have just gone away by itself if we would have let it go away, let it go on a little bit longer.
When you're vaccinating, it's very important to get vaccines at the time that your baby needs them, at an age where your baby's at a highest risk of catching diseases. But when you look at the American Academy of Pediatrics vaccine schedule, part of it, to me, doesn't make sense. For example, hepatitis B vaccine. Hepatitis B is a sexually transmitted infection. The only way to catch Hep B is through blood exposure or exposure from bodily fluids from an infected person. Babies have virtually zero risk of catching hepatitis B. So you might ask, why do we vaccinate? Why did the AAP decide to bring that vaccine onto the schedule? The reason is about 1% of our population carries hepatitis B in their system, about 1% of moms. And when that mom gives birth, she can pass the infection on to her baby. So the AAP felt it'd be better to vaccinate all babies so that everyone is covered. However, obstetricians screen all their pregnant patients to determine which ones have Hep B and which ones don't. So through screening, it's very easy to determine which babies need a hepatitis B vaccine. 99% of babies in the US don't need a hepatitis B vaccine.